Welcome, everyone. I hope everyone's having a great evening so far. I know people are joining us from all over, and we are here in snowy Calgary. I don't know, maybe I'll share this. You can see all the snow out there for you guys that are, I know, somewhere in a warmer place. So my name is Fernandes. I'm going to talk to you about cardiovascular disease and COVID. There's lots of stuff going on today, so especially with the update of COVID-19 specifically to heart disease. And that's really what my focus is going to be on today. And if you have any questions, you can put them in there, but I'm going to do all the questions at the end, and I'll stay to the end and get as many questions as I can answered at the end. So we'll go through that. So for those of you who don't know me, welcome. Welcome to the HeartFit Clinic. We have a clinic in Calgary and Edmonton. My name is Fernandes. I'm the founder of the HeartFit Clinic, and I'm also your published author. I'll be giving one of our books away for free today, so stay to the end and I'll give that to you as well. And I just want to make sure that you get some valuable information to help you with this situation. I want to put some factual things in front of you so you understand the case and what's happening with heart disease in today's world, especially in Canada. So when we look at heart disease, it's a very important thing. And so before I get anywhere further, I always want to take a time to thank you for being here today. Thank you for taking the time out of your busy day to be here and listen to some valuable information. I promise that I'll deliver some great information to you. So this is a disclaimer. I just want to make sure that you don't take everything that I say and start doing something. It's very important that you have a consultation with the HeartFit Clinic to, with your healthcare professionals, whoever it may be, before you start doing anything. So just a little quick disclaimer with that part of it. And so here I am. I'm talking to you from our clinic. I'm not in my pajama bottoms, although I could be, I guess, but I'm in the clinic. It's hard for me to do it from home. For those of you who don't know, I have 3 boys at home, and it's right in the middle of bedtime for them right now. And they've been texting me all these good wishes right now. So it was really nice from here. So what I'm going to talk about today, I'm going to go through some statistics. I'm going to talk to you about what can we do to prevent the virus and heart disease. I'm going to talk about immune function and why it's so important in both situations. I'm going to talk about medications. We've been getting a lot of medication questions in the last couple of weeks to discontinue medications or not that it's, not that it's a problem to discontinue sometimes because we're doing right things, but should you discontinue? And that's, again, a very big conversation that you have to have with us or your healthcare professional before you go ahead and do that. Vital foods I'm going to talk about, and some key supplements. I was doing this webinar, and I was putting all the slides last minute together. I've been working on this for a number of weeks for you guys, and it's taken me a lot of content. I actually deleted, Deborah was going through my slides, who's our office coordinator in Calgary. And I was going through the slides with her, and she said, that's way too many slides. So I actually ended up deleting, I think are always important slides. Otherwise, I wouldn't have put them in there for you. But I ended up deleting like 20 slides. And so I'm happy to go really dive in depth with each one of these. And a lot of these things I can go into real in-depth topics onto how you can prevent and reverse heart disease. And so I'll go into that part of it. So that's the outline for today. I hope this webinar to be about 45 minutes approximately. Answering your questions and making sure you get some good quality out of this. And the reason why I'm putting this on, a lot of people don't know, I love all you guys. I love to help you understand what you can do to prevent and reverse disease. And so I'm always on the lookout as to what we can do. And so I sit on a board of Canadian Association of Cardiovascular Prevention and Rehab. I'm also on the board with CCS there. And I've been getting a lot of emails and inundation from cardiologists. I'm not a cardiologist, but a lot of, emails from everyone saying, okay, what should we do? What's happening? And so I'm going to present some of this stuff to you, just some guideline statements that we put together so you understand the conventional side of things. And then what can we do from a unconventional yet evidence-based approach to treating disease? And so COVID-19, let's just talk about some stats here. It's substantial hospitalizations and deaths worldwide. We know that. It's a big concern, but the most vulnerable, and this is why you're on the webinar, are those people that have compromised function or invite the host in the virus in. So those people that have cardiovascular disease, hypertension, diabetes, overweight, And as all of you know, I can dive into each one of these topics in quite depth, but I want to keep this a little bit above the surface so you understand the COVID-19 situation and heart disease. So here's the studies that show that the cardiovascular disease risk factors: diabetes, hypertension, smoking, coronary artery disease. This is the literature to present to show that this population is the most at risk. Again, another slide showing this, just showing even with cerebral vascular disease, which is obviously stroke and whatnot, that's it's just ischemic in nature, or it could be non-ischemic, but anyway, that's going off the topic. But these are the most prone or vulnerable populations to have COVID-19. Here's some Canadian statistics. And so here we can see, I know it's a busy slide, but I really want you to understand where the curve is as to most of the people that are getting COVID-19. And here's the fatality. You can see that a lot of our fatalities start to happen above 60 years old, up into 80 plus. And you can see what our comorbidities are when we're looking at this. So cardiovascular disease, anywhere from 4 to 15%, diabetics up to 20%, hypertension, really big one. And I can dive into these topics real quickly, or not quickly, but more in depth. And so hypertension is a big one, coronary artery disease and cerebral vascular disease. And so you can see the statistics there. So this is a screenshot of my computer this morning, and it's showing, I'm sure it's more than this now, but this morning it was 1.3, almost 4 million cases that are confirmed. You can see it's spread across the world. Obviously, USA leading the case. Canada, we're sitting at about 17,000 people. But here you can see the deaths of people, 76,000 people. That's quite a bit, and it's sad for it to happen. Such a quick way. The virus comes and obviously attacks the patient, and then sometimes the fight with it is not very long, and so it can attack people very quickly. So why is COVID-19 so unique? Well, COVID-19, the problem is that we're really asymptomatic. We don't know that we have the virus, and so that's why it's a problem, or even can be just mildly symptomatic, and that happens in the large population of people. And so it's not a problem, for healthy people, but for me, it's a problem that, let's say I do catch the virus, I don't even know I have it, and then let's say I go to my parents' house and then I give it to them. Now they're at increased risk. And so another issue, and this is talking more from a worldwide standpoint, but there are inadequate testing capabilities in most geographies, and therefore we don't really get the true number. I know I showed you 1.4 million people here, but the truth is we don't know what that number is. It could be, they're saying probably double this. And so and then there are complications, and death often ensues much later than the actual contagion. And so in severe cases, it may present as pneumonia, which is acute respiratory distress syndrome. And so there are many things that we can look at when we're looking at the uniqueness of this virus, different than influenza or different than H1N1 or SARS. And many of you heard those complications that came out before that. And so the incidence of cardiovascular disease does not decline during these times. And I'm very curious to see the statistics going back, or the meta-analysis, what we say, to going back to seeing what all that data shows during this trauma time. Because what I'm about to share with you is some really important slides as to what's being compromised. And so this is some old statistics. I took it from an old slide of mine, but 17.9 million people died from cardiovascular disease in 2016. Now that number is not declining, so it's around that last year. That represents 31% of all the global deaths, and of these deaths, 85% are due to heart attack and stroke. So the incidence of heart disease does not stop during this time, and that's why it's so important to focus on your heart health with all the things that we'll be doing at the Heart Fit Clinic. So absolutely very important. We got to flatten the curve. And so I want you to imagine these as tidal waves. And people, especially like myself, are preaching cardiovascular disease. We got to make sure we reverse and prevent cardiovascular disease. And those are all important things. But we're, unfortunately, used to the tidal wave coming at us with cardiovascular disease, or the wave, I'll call it. But when COVID-19 comes along, it's a tidal wave. And the healthcare professionals are not prepared for a tidal wave coming at us. And so therefore, it's really important to flatten the curve. And that's the reason why we want to flatten the curve. We want to be predictive in the cases rather than being not predictive. And so, you hear a lot of things that are going on in the healthcare system. We're not ready. But I think now they are starting to get ready. I got a lot of friends that are in the healthcare professionals. And yes, it's important for us to flatten the curve because we're not used to this tidal wave coming in place. And now they're taking up hotels and areas where they can eventually put potential cases and treat them there. And so, we're working hard and everyone's doing their best. And that's the most important part you have to understand. Yes, we can do better. Absolutely, we can do better. But everyone's doing their best. And so I ask that we don't get angry at healthcare professionals. I think they're doing an amazing job, especially the ones on the front line. And so important to flatten the curve, but we're not used to that tsunami that's coming up at us. The concern and the problem is that wave continues to come at us from a heart disease side of things. So people are still having heart attacks and strokes and heart failure and all those parts of things. So that's still happening. And so I was talking with a cardiologist in Montreal a few days ago, and he's saying that, now we actually have a COVID-19 ward on our hospital. And Montreal, as you know, it's got a high incidence of COVID-19 cases there. And now they're talking about taking over their cardiovascular unit as well. And so then my question becomes, okay, what are we missing? What's going on from that side of it? So COVID-19, heart disease, heart failure, they all present very similar. And that's the problem that we're seeing in the healthcare system. And I'm going to provide a couple case studies to show you this part of it too. And so the potential mechanism of the viral infection on cardiovascular disease, it can mimic a heart attack, it can mimic heart failure symptoms, and it also can show arrhythmia. And we don't know if the arrhythmia is due to the virus or is it due to actually some other cause, which we're always used to seeing or anything like that. And so this is the problem with this specific COVID-19 and how it affects the body that way. And so I don't want to get too technical here, but again, this is the reasons why. Actually, I'm going to skip this slide. I don't need to go in the depth of it. But we know, for those of you who heard me speak before, I talk about this red zone and a green zone. And the red zone is a danger zone. That's where you're having that emergency, chest pain, heart failure symptoms, whatever it might be. And if it's a heart attack, then we want to do medical management. It's called fibrinolytic therapy, which we call, for simplicity's sake, it's clot busters. So if we find out that you're having a heart attack, again, I got whole talks on that part of it. But if we find out that you're actually having a heart attack, then we want to medically manage you. And now we're concerned that that's all we're going to do, right? Because the data shows that it's best to medically manage that person in the right situation. But if you're having a very specific type of heart attack, it's important to perhaps stent right away, that's where we see better outcomes. But now we're talking, should we put that patient at risk, or do we put ourselves at risk because that patient might have COVID-19 and spread it around? So now there's talks about, maybe we don't need to go to the cath lab, which is where we do an angiogram, which we look right inside the arterial walls of the heart. We can see right inside and we can say, okay, we've got a plumbing problem, but we know that, I'll get to it. And of course, my presentations are not complete without me saying arteries are a muscle, not a pipe. But we look at the arteries like a plumbing problem, we see where the blockages are, and then we want to open that up with clot busters, which is the medical management, but also then with a stent. But what we're finding now in our Canadian system, and even with with the cardiovascular community in other parts of the world, they're not doing this. And that's it's a sad state, but as long as we can stabilize the patient, and I wish I could open up heart fit clinics all around the world to help people with our therapies and treatments, that's really where it's going to come into play. And I can't wait to see, not in a good way, but the statistics as to what's going to come from this event. And so, again, I'm going to skip this slide. It just talks about the technicalities of what I said. So basically, the summary of COVID-19 from a hospital side of things is that those with cardiovascular disease and COVID-19 have an increased risk of the disease itself and death. The infection can also be associated with multiple direct and indirect cardiovascular complications. So it can show as an acute heart injury, it could show as inflammation of the heart, or it can show as a clot or arrhythmias. And so those are important things to understand too. So there are therapies that are under investigations for COVID-19 that may also have, they may result in cardiovascular side effects. And that's another concern that we're seeing. So the treatments that you might hear about, I'm not going to get technical with that part of it because that is not my expertise with the treatments of it. But I know that the treatments that they use with COVID-19, the specific medications that they're using can also have cardiovascular complications. And then the response to COVID-19 can compromise the rapid triage, as I just explained in the slide before, of non-COVID-19 patients. So these are patients that are coming in the hospital, the wave that we're used to seeing, and they're coming in with the chest pain, the heart attack, the symptoms, and maybe we're not triaging or doing as good as a job because of the tidal wave that we're seeing from the COVID-19 cases. And then cardiovascular care may be a place where healthcare workers are in a position to kind of be vulnerable to the virus, and therefore can be a transmission to different sources that way. So it's a little complicated out there with COVID-19 and heart disease. You can see where it compromises even our I think we have a very great acute healthcare system. And so, especially in Canada, there are some discussions to have after that, of course. And so here's some cases that I just want to share with you, and I'll explain this, but really what I want to take out of this slide is this is a patient that came in with flu-like symptoms. They had a heart attack. They were showing that they were having a heart attack, but they weren't sure if this patient had myocarditis or if it was COVID. And they actually treated this patient as a heart patient, and they found that it was a patient that has heart disease and no COVID. But that's an interesting case. Again, another patient with flu-like symptoms. These are not chest pains, right? These are someone who's coming in thinking, oh, we suspect COVID. But it's flu-like symptoms that this person's getting. This is, again, they basically were deteriorating quite a bit, and they actually ended up having one of their arteries obstructed. And basically, they were COVID negative, and they ended up going for a bypass surgery, and they had an emergency mitral valve repair. And so, again, flu-like symptoms, thinking COVID, but it's actually heart disease. And here's another case, a 47-year-old Southeast Asian diabetic, had a heart attack. It's showing there. He had severe multivessel disease, and they ended up, normally what they would do in this case is this is an interesting study, is that they actually stented all the lesions, which I'm not a big fan of, and nor the literature is. They should have just stented the culprit, but in this case, they actually ended up doing bypass surgery. So just to show you the cases that are happening out there. And here's another case. This is a patient that was a COVID-19 patient, but they were looking like they're presenting in the hospital. And this is an actual case that happened 2 weeks ago. This is a case where they were showing like they were having a heart attack, but it was just their COVID-19 symptoms. And so anyway, my point is it makes it a challenging environment for our healthcare professionals, especially on the ER department. And so the current COVID-19 therapies, arrhythmias, it can cause severe high blood pressure, blood clots, fluid retention, electrolyte disturbances. So there's lots of things that can happen. Okay, let's take a deep breath and let's talk about probably the biggest question I've gotten in the last couple of weeks. And so for those who don't know, we did a live webinar like this for yoga, and it was just a way for us to, I just like to calm. It's important to be calm, especially in a panicked environment. And so I'll talk a little bit about more of that today. No, we're not going to do a yoga session, but we can breathe. So when we talk about medications, should we stop them? And I'm not going to, I took out a whole bunch of slides here, and I really want to share with you, should I stop them or not? And it's so important that you talk to us at the HeartFit Clinic about whether you decide to start or stop your medications. But let's talk about what happens here. So we've got the renin-angiotensin-aldosterone system. Now, I don't expect you guys to become experts at this, but what happens is there are certain medications that are blood pressure lowering medications. So renin-angiotensin-aldosterone system inhibitors are things that will stop this system from activating, so it lowers, the goal is to just lower your blood pressure. And really what it's doing is it's attacking the lungs. And so I'm getting really technical here, but I really want, I'm going to be very specific. Try not to get lost in this slide. But there are two things that we're concerned about. I know there were some studies showing out there that, or people saying, especially in social media, as to, we should stop ACE inhibitors because of the problems that it can do. And yes, there are some problems from the viral load, but then there's some good things that happen from the inflammation load. And so specifically, the possible concern is that when you have this ACE2 receptor, the virus attaches to it more easily and gets into the lungs and allows for viral entry into the lungs. Now, this is not confirmed. There's no studies to show that this is a bad thing. And it's not a bad thing that if you're on your medications or not. And I'll get to that in a second. The good benefit from this is that it does with the system, and this is the way, I'm not going to go into the details of this, but really what happens is it actually increases angiotensin 2, and it inhibits that. And therefore, we decrease inflammation in the lung. So there are two things that happen. One is good, one is bad, but we don't know how bad the bad is, and we know the good is good. And so the result is, and I'm going to skip this slide, is you do not want to stop your renin, angiotensin, aldosterone system inhibitors, especially in heart failure patients, especially if you have high blood pressure. And so here's the statement that was released from the Canadian Cardiovascular Society. We strongly discourage the discontinuation of guidelines directed for medical therapy involving angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, or angiotensin receptive nephrosilin inhibitors. And I'll talk about those in a second and what they are. And so we want to not stop these ones. And so the update on blood pressure medications is you should not stop this. You should be talking to your healthcare professional as to whether you should or not, because we're getting you healthier. But whether, if you're taking these and your blood pressure is high, remember, the virus is most prone in hypertensive patients. And so by you stopping a medication that lowers your blood pressure, it's not a good thing. So if you're wondering what your ACE inhibitors are, they're the ones like that end with a pril, so ramipril or perindopril. Your ARBs, your angiotensin receptor blockers, are anything that ends with sartan, so losartan, valsartan. And then the angiotensin, the ARNs we call them, is a newer class of drugs on the block, which is Entresto. And so again, do not stop your medications. And I want you to understand that there are some important things that you can do to improve your blood pressure. And I'll get into that at the near the end of the talk today. And so you can stop your medications if you're hypotensive, if you have acute kidney disease, or you have increased potassium, which we call hyperkalemia. And again, this is something that you should talk to your healthcare professional before you start to discontinue this, because we don't want you having high blood pressure. High blood pressure, as you know, I'm a big fan of getting people off their medications. But if there's one medication I think that is the most important, if you have high blood pressure, is to have a high blood pressure medication. You want to address that problem as quick as you can with medication, with supplements, with foods. And I got a whole talk just that I do on hypertension. So aspirin is another one of the medications that came out there, and people are like, well, should I worry about my blood being too thin because of this? And so patients taking low dose aspirin for heart disease should continue taking it unless otherwise advised by a physician. And so having the COVID-19 is not a reason to stop it. There are other reasons to stop aspirin. I'm not a big fan of this medication, but in the right population, it is okay. And again, that's a conversation you have to have with us individually, not with hundreds of people online here, where I can go into the detail that I want to go into as to whether you can stop your medications. Again, you can call in one of our clinics to help out with that part of it. And so in March 20th, there was no clinical evidence regarding the NSAIDs, the Advils and that type of thing. However, I would stay away from this. And the reason for that is there is some preliminary data on it. I wasn't able to, it's one of the things I took out and I thought I'd just talk about it. But patients with heart failure or hypertension, you should ideally choose something like acetaminophen, which is Tylenol over NSAIDs anyways, to reduce a fever or pain. So that's my suggestions on the NSAIDs there. So let's get into some little bit more details as to what's happening with COVID-19, and hope everyone's keeping okay out there. So I'll take another deep breath with that part of it. And, what I want to end up doing now is talk about 5 things that we can do to make COVID-19 better. And let's go through them. So number 1, we've got to optimize our own health, and we have to do it not just for yourself. I mean, yeah, we all know we should eat better. We all know we should lose weight. We all know we should be exercising. We all know those things, but now we have to do it for for the world. We have to do it to flatten the curve. And so when you optimize your health, think about you're doing it for other people. You're being of service to other people. Hygiene. It's important to have good hygiene out there. We know that now. And social distancing. I got a little funny slide here, but kissing with masks. I think that might be a little bit too close, but anyway. And then, we might even consider talking about having this herd immunity. We're thinking that, the data is now showing that probably anywhere between 40 to 70% of us will probably get the virus, and 80% of us will be mild, 20% might be serious, and we'll get through that part, and 5% may result in death. And that's just the early statistics. I think it's going to be a lot lower, the death rate. But having that herd immunity, therefore, it becomes so important that your body is ready to take that virus on there. And so then the treatments, and that's the last thing. And so there's going to be a vaccine out there. There's going to be lots of virtual education, and it's important to increase immunity. And so those are the treatments that are involved with coronavirus. And so with optimizing health, I know there's lots of things that we can do. And let's face it, the world's different. It's going to be different, just like it was for 9/11. I don't know if you remember out there with, flying in the airplane after 9/11 happened. It was a little bit scary and stuff like that. So what happens is that we do go through, we got to protect our mental health. And there are 5 stages of grief that I think everyone's going through right now. And, first we deny it. It's like, okay, it's not a big deal, not worry about it. And then you're angry because, you're not able to do the things you want to do. You're not able to, go to your vacation that you were planning last week, or your spring break vacation. And then you bargain and you'll be like, okay, well, if I do this, I'm okay. If I do that, I'm okay. And then we get into a state of depression. And then we get to the final phase of acceptance. Now, there are many stages of grief. I'm not a psychologist specialist, but really what I want to share with you is that you got to protect your mind. And it's okay. I want you to understand that it's okay to go through those stages of grief. Yeah, it's a lot of negativity out there. There's a lot of, we're worried about, is there going to be an end to this? But you got to keep hope alive. You got to keep hope alive with that part of it and protect your mind. That's the most important thing you can do. You can protect what goes on in between here. And so viruses like to find places they are welcome. And, I'm a big believer in this part of it. If your body is susceptible to a virus, so let me put it this way. There are many people that can contract the virus. Some people won't even know it. And as we know, some people undergo severe situations to it. What I'm trying to share with you is that if you're in a state where you're always worried and fear, you're actually welcoming. Viruses come to places where they're welcome. And you want to make sure your body doesn't welcome them. And so even if the virus comes in, it just says, I can block you out. And so I think it's so important to be informed. I get all my information, and there's a world events going on. I get it in about 1 or 2 minutes, first thing in the morning. That's it. I don't need to be watching any news. I don't need to know about all the different stories out there. I'm not as informed as the next person, but I'm not going to allow negativity. I think there's a lot of negativity out there. And I'm worried about all the news that we might be even missing, right? And so I think it's be informed, but be strategic with that part of it. And then we get into a place of fear. We get in a place where we're fearing things. And what happens when you're in a state of fear is you get into this fight or flight, or even freeze for that matter. And you're like, okay, what do I gotta do? Or I gotta panic, and we're not. The problem is then we don't think properly. And what technically happens is we got this prefrontal cortex in our brain. And this is where our critical thinking occurs. This is where our executive functions occur. This is where our decision-making happens. And what happens is that when you're in a fight or flight mode, we turn this all off. And when we turn this all off, we get, when it doesn't function well, we get personality changes. We get abnormalities in emotional responses. And we get general difficulty in functioning in our daily lives. And so that's what happens. This is fact. That's what happens when we're in a fight or flight response. That's what happens. And as a result, we get into panic. We start to focus on, okay, well, I got to stock up on toilet paper. And, and you get the shelves emptying and all the wrong things, unfortunately. I'm gonna be honest with you. The whole talk, if there's anything you don't listen to me, they're emptying the wrong things off the shelf. Toilet paper, well, there's a lot of other substances that we could use. And we're unloading the wrong foods off the shelves and that are unhealthy for us. That again becomes a host to the virus. And then we're also unloading a lot of key supplements that are the wrong ones as well. And so the opposite of that is we got to be calm and relaxed. We got to take that breath and relax. And you have a choice to be able to do that. And how we do that, I know it's easier said than done, but this is a practice. And I have a whole yoga program that I can share with you we can help you out with that part of it. That's what HeartFit University is for, and that's what the HeartFit Clinic's for, is we're here to help you be calm and relaxed and have a feeling of gratitude. Because when you do start to think of good things, that's where we change the focus of what's going on in between in our head there. And have laughter and connection. This is my kids here and my wife. And you can see that, it's important to have connection at this time and laughter, and especially this little guy here. He's my 3-year-old. What a funny little guy that guy is. Anyway, important to do this because it's an act of service. It's an act of service where we can, you're not doing it for yourself anymore. We're trying to do it for the greater good. And you're trying to be a contribution to the society. And when you are in a state of fear, we're not contributing, right? So I want you to be in a place where you can contribute. And that's why, again, I can go into a whole talk just on improving immune function, but I'll give you some highlights as to what we can do today. And so what happens, I want to get a little bit technical here, but what happens when we're in a fight, a flight, or a freeze mode? What happens? And so what happens is we increase cortisol. And when we increase cortisol, it increases our blood pressure. We already know the stats from blood pressure, increases our blood sugar. We already know the stats from diabetics. It also increases inflammation, but it decreases our immune function. And that's the biggest thing that happens when we end up doing this. And so our immune response, there's also a cardiovascular response inside the artery as well. And I'm not going to get technical with the artery, but I will a little bit today to understand the immune response that happens to the arterial wall. And also with aging. Aging starts to decrease our immune response as well. So then now it becomes more important to put better foods inside us, supplement really well. And again, I'll give you my top supplements that I'm going to recommend here from this webinar. You can pick it up at our clinics. And so abnormal cholesterol, it affects our immune response. And so what does this have to do with my arteries? What does immune function have to do with my arteries? So let me get technical, and some of you might have seen this before, but again, my presentations aren't complete without me talking about this. Arteries are a muscle, not a pipe. They're not a plumbing problem. It's not how we fix it. We don't throw liquid Drano down there. We don't go in there and scrape it out or anything like that. You can't do that to the artery. Artery's all skin. If you look inside the artery wall, it's all skin. And it's got a muscular layer to it. And that skin can get hurt, right? That skin can get hurt. And when that immune response happens, it happens to the arterial wall. So here you can see the artery. But what I'm going to actually share with you is the process of atherosclerosis and things that we do at the HeartFit Clinic here. And so here I'm going to zoom in just on that section of the arterial wall. You can see it's live. It's a layer of skin there. You can see those circles there. Hopefully everyone can see that. And then what happens is that you've got an immune response that happens right at that level here. So what happens is you got these atherogenic or plaque-causing particles, abnormal cholesterol profiles that we look a lot differently at the HeartFit Clinic than you do get at your doctor's office. So if you haven't done this, it's very important to understand those particles that can seep inside the lining of the skin. So once that happens, it gets broken down. And once that gets broken down, this is an area where the blood doesn't flow anymore. The blood flows on this side where 1 is, but now 2, the blood doesn't flow anymore. So it gets broken down. And once it gets broken down, here's the immune response. A white blood cell sees that as a foreign body. And when it sees it as a foreign body, it eats it up and it becomes a macrophage. Once it becomes a macrophage, it becomes a foam cell and then a plaque. And so it's actually a whole atherogenic or plaque building process that happens here. But what I really want you to understand is it's so important to have an improved immune function is for this. If you have good immune function, this white blood cell doesn't undergo through this process. you get an immune response. So you get and I'll talk about this here in the next picture. You get a number of things that can hurt that skin. A number of things that can hurt the skin. We all hear about inflammation, right? Inflammation can hurt that skin, but also poor immune response can also result in a response that can be dangerous. So if you have a poor immune response inside the arteries, no good. We already know the poor immune response that can happen to the viruses out there. But if you have a poor immune response as well, so it's important to improve your immune function for 2 reasons. Now I just shared with you, it's important to do that to improve artery health, but it's also important to improve it from immune function, just to ward off viruses and attacks that happen on our immune function. We have attacks on our immune function all day long, right? And so our immune function is the one that keeps us going. And so how do we improve our immune function? Yes, it's important to sleep and exercise and keep calm. Those are important things. And yes, we know that. And now that people are maybe off routine a little bit, it makes a difference. It makes a difference. Our immune function gets a little bit compromised if we're like, okay, well, I don't have to really get up and get ready for work, and I can, laze around a little bit, and therefore I can, watch that next Netflix movie a little bit longer. And now I'm pushing my bedtime or my routine out a little bit more than it should be. That can affect our immune function, right? Exercise. We all know the benefits of exercise. If you're inside and whatever the weather is, I mean, it's not like it's minus 30 outside. Of course, we don't want that. But go out, get a little bit of fresh air just for a little bit. Get some activity in there. You can do things in the house. There are a lot of now people doing, workouts online at gyms for free now. So take advantage of that. And of course, keep calm. Lots of resources out there to keep calm, breath awareness, calming down, breathing, making sure that you can connect with yourself. And again, we're doing this for, yes, ourselves, but we're doing it for the greater good to contribute out there. But how do we improve immune function? This is where I'm going to dive in a little bit more deeper. Micronutrient deficiencies. It's so important to understand micronutrient deficiencies. It's also important. I'm going to quickly share some foods. Again, I can go into these topics multiple times. These are all talks and conversations that I could do on its own, but I just wanted to give you a quick summary today. And then supplements. Supplements are another important thing that, unfortunately, we got to supplement. If we become deficient, we got to supplement. I take probably about 11 supplements a day. I'm 44 today. It's not my birthday today, but I'm 44 years old. And, I'm not the same person as I was 24, but I feel the same. I feel like I can do exactly what I want to do when I was, 20 years ago as I can today. Now, and for those who don't know, I like to play hockey, and I play with guys playing hockey, and I compete at the same level I did, 20 years ago. And maybe they don't like it at all, but that's okay. But I like to compete. I love to be able to push myself and do the things I do that. So it's important to make sure that I have the right foods and supplements so that I can be the best person I can be. And so let's talk about micronutrient deficiencies. So if you have inflammation, we talked about inflammation, you could have deficiency in any one of these nutrients, and it can cause leave your body susceptible to inflammation, right? And you can, I'm happy to share some of these slides with you guys if you want afterwards, just ask me. Dyslipidemia. If you have abnormal cholesterol, this is where it's important to find out, well, why do you have abnormal cholesterol? That's dyslipidemia. This is what we do at the HeartFit Clinic. We find out what's going on. Why do you have that problem? If you don't find out why, then we just keep on taking pills. And I'm a big fan of medications as needed, but I like to get people off of medications once we fix the underlying root cause problem at the HeartFit Clinic. That's what we do at the HeartFit Clinic. And same thing with other issues such as high blood pressure. High blood pressure. Many times you go see your doctor, okay, let's get you on a pill. But do we ever start to look at deficiencies? It's so important to look at deficiencies as to why you might have high blood pressure, why you might have those issues. And that's where it's important to look at these important supplements that way. Diabetes, same idea. And yes, diabetes, we think it's just a food issue, but I could eat the same foods as someone else, and I don't eat poorly, but we can end up with 2 different outcomes. And my point is that you could be deficient and you can end up with a problem and I may not. And so it's important to look at these deficiencies that we do at the HeartFit Clinic. And even depression, especially in this state, and even anxiety for that matter, there's things out there that it's making us more anxious. And maybe it's because you're deficient and you're more prone to being anxious, especially with the news going on and all those things. So there are some certain things to look at from a biochemical side of things to improve or minimize the risk of depression or even anxiety that way. And so even weight management, if you're overweight, I like to find out why. People try many things, and there are different umbrellas that we look at the HeartFit Clinic to see, well, why do you have this problem? And I go through a lot of umbrellas to then get to the culprit. And once we get to the culprit, then we fix that, right? So if you're deficient in any nutrients, it is so important to find out what. I think I did mine in January, and I get this done, every year. And I was deficient in a few things that I never expected to be deficient in. So that's why I'm supplementing, right? And so I got to make sure I'm at my best for you, for my family, for my loved ones, for my colleagues at the HeartFit Clinic. So food is medicine, and I can go super in depth here with food, and I'm not going to. And I'm doing that only because I don't have enough time, and I want to keep this. I want to kind of end on time for some questions there too. So food is medicine, and we know that. And so if I were to give you one thing, viruses feed on sugar, right? They feed on sugar. It's a proven fact. And so the foods that you want to focus on are foods that have lower glycemic index, foods that are not processed or refined. The stuff that's emptying through the shelves of the grocery store, doesn't matter. Doesn't matter. Go find the healthy stuff, the stuff that's going to keep you to fight immune activities that happen, keep your immune system strongest. Protein is very important. This is why I don't recommend people, if they're not vegetarian, whether it be for religious reasons or medical reasons or whatever it might be, but I'm not a fan of vegetarian because we miss this protein. It's high in zinc, seafood, nuts, amino acids, vitamin A. It's high in vitamin A with animal proteins, eggs, fish, liver. And then vitamin C foods and iron, which you'll find in kiwi and green leafy vegetables and citrus foods. And so those are some really good foods to focus on. Just go to the grocery store and just kind of keep this as a guidance tool. Okay, well, I'm going to pick foods that don't convert to sugar very quickly. Okay, great. I'm going to stay away from processed foods. So the foods that, if something has to advertise to you their benefits, stay away from them. I say that in my book as well. And, if something has to advertise to you, I don't ever see the fruits and vegetables advertised to you. So stay away from those processed foods or refined foods. And proteins, I know there's a lot of stuff talking out there about the harm of, animal proteins and all that part of it. If you're doing it for that reason, that's fine. Then you got to make sure that you get those sources of protein inside of your body. And there are an abundance of herbs and spices that are very important. And the ones I can think of are garlic and turmeric and oregano, ginger. Those are so many peppers. They're very high immune functioning foods. And remember, when we improve our immune function with foods, you're actually improving your immune function to help with artery disease, right, too. So we're doing it for two different reasons. And again, we can go on a whole talk with this. Karen does a great talk with this part of it with optimal gut health as well. And so we want to be able to have optimal gut health. And we have a whole formula that we can help people improve their gut health. And so, yes, it involves foods and some supplementation as well. So even taking a probiotic might be a good idea. And that's something that we can give to you at the HeartFit Clinic. So supplements. Before I get into this part of it, I found this slide very funny. And the vitamin C, all gone from the pharmacy. It's, when you look at that part of it, I think they're taking the wrong foods. And I'll get into the details of it in a little bit here, but I'm going to give you my top supplements that I think you should have during this time. And you can pick it up at our clinics there. So these are key immune boosters and artery boosters as well to help artery function and immune function as well. And so we have two different vitamin C's, but vitamin C liposomal. The reason why I'm suggesting liposomal, this is a little squirt that you put into your mouth and you let it sit there for about a minute, and it ends up coming it gets into your body through a different tract. It doesn't go. So when you have vitamin C from the health food store, it's not absorbable. It goes through the gut and it doesn't get absorbed. This is like 40 times more absorbable, and it's way more beneficial. And so vitamin C liposomal is something that I'd recommend, especially to fight off viruses. We know the benefits of that part of it. The other one, I'm a big fan of using liposomal glutathione. We know that glutathione is one of the most important. Again, I've got talks on each one of these separately. So again, I want to finish on time here and make sure I answer some questions for you guys today. So liposomal glutathione becomes very important because it's one of the most important antioxidants to fight off any infections. The other thing I recommend is nitric oxide, whether you take it as a powder or you take it as a neoprofessional. There are a lot of good literature showing the benefits of taking nitric oxide to improve immune function. Nitric oxide is one of the most powerful things that you can give to your body to help with artery disease. What it does is it dilates the arteries. And again, I got a whole talk on nitric oxide on alone, but it dilates the arteries to allow the blood to flow a lot more smoother. And so it's an important supplement to have in the arsenal. And the last one I'm going to recommend, and there are a lot more other ones, it's important to find your deficiencies, is Arterial Cell. Arterial Cell is one of my favorite supplements, especially if you have artery disease. So this is someone who has artery disease or hypertension. If you have a compromised, we've got this skin. We now know the artery is a muscle, right? It's not a pipe. And this skin gets protected when we have arterial cells. So it prevents any inflammatory response, but also prevents the immune response that happens with this. So this is one of my most important supplements to help open up arteries and improve the artery function. And then if you do have heart disease, like an actual artery disease, it actually changes the composition of plaques better than a cholesterol-lowering pill. That's why doctors are talking about cholesterol-lowering pill benefits. Well, this one's, the studies on this are showing really, really great. And again, I have a whole talk that I can do on all this part of it. So that's everything I want to be able to do. All our supplements are curbside pickup and delivery. So if you're worried about that part of it, you can purchase them at our clinic, and we can send them off to you curbside, or we can deliver them anywhere around wherever you are. I mean, we got patients all over Canada that have come and seen us. In fact, we've got people in Africa. It might be a little bit of problems getting you supplements out that way. But anyway, those are the options that we have. So we can do that for you, curbside pickup and delivery at our clinic, at the HeartFit Clinic. And so I make sure that you take advantage of the free book offer that I'm giving you guys today. And the link should have been there. If you didn't get it, I'll make sure that all of you get that link so you can start reading and understand the principles about preventing and reversing heart disease. And so again, I want to thank you for taking the time out of your busy day to be here and listen to this quick update on COVID-19. Again, remember, we got to flatten the curve, and we're doing it, for everybody. So it's important to take care of yourself at most and prevent that tsunami from coming at us, and be as best as you can and prepared for preventing and reversing COVID-19 and even heart disease. So I'll welcome any questions that you might have. And there's a little area on the window there that you can chat, and you can see what's going on with that part of it. So I welcome any questions that you might have, and I'm going to start answering. Like, God, I got so many of them, but I'll stick around and answer. If you put them in the chat there, you can see that down below. I'll do my best to answer through them. So question number one. So does blood pressure go up even though taking medications with detecting infection in the body? Answer to that is yes. Blood pressure can go up in spite of taking medications. When you're battling an infection, it can constrict the arteries. And so that's why when you're having an infection, it's important to have those supplements that I talked about there. Again, the nitric oxide supplement would be the most powerful one to help, especially when you're fighting an infection, to keep the dilation of your artery walls there. So that's my quick answer to that. Again, I'll try not to go detail with all these ones there. It does this affect some with heart failure. I don't know if I understand the question there. Does this affect some with heart failure? So heart failure are more prone to having COVID-19 for two reasons. Number one, their heart function's compromised, but also their immune function's compromised. And so it can affect patients with heart failure. And if you have heart failure, we have a whole medication or supplement regimen that you should be on to improve your heart function. And of course, we have the external counterpulsation therapy at our clinic as well. So hopefully that answered that question there. So next question is, how vulnerable is is someone with a pacemaker due to bradycardia, if you're otherwise relatively active. Now, a pacemaker, just to make sure you understand it, I'd like to know, there's a little bit of issues with this. Number one, I don't think having a low heart rate makes you susceptible to COVID-19. There's no statistics on that or data on that part of it. But the pacemaker, what I do want to know is as to when it actually kicks in. And so a pacemaker is designed to keep your heart rate within a certain parameters. And if it doesn't fall into those parameters, then that's when the pacemaker kicks in. So if you're getting into those parameters quite a bit, then that can affect our immune function a little bit. But if you have a pacemaker and it's not being activated and you're relatively healthy, then that shouldn't be an issue. So hopefully that answered that question there. So what is the relationship between hypothyroidism and heart disease, specifically hypertension? I could do a whole talk on this. There is a relationship. So there's a relationship between all hormone activity and heart disease and hypertension. And so it's one of the pillars that we look at the HeartFit Clinic. And so I think it's important to make sure that you understand what level of hypothyroidism you're on, and as well as you're treated for that too. So yes, I guess the answer to the question is yes, hypothyroidism and heart disease and hypertension are all linked together that way. So they all have a link with each other. One of the umbrellas that we look at the HeartFit Clinic is looking at hormone function. Next question was, I'm hearing a lot about a supplement called DHEA. Is any you can share about this? I think it's important to get tested first before you start taking DHEA. So again, that falls into, if you're taking DHEA just for the fun of it, it may not be necessary. And so the quick question is, get a test. We can do that at the HeartFit Clinic. Find out what your DHEA levels are. Find out where all your hormones are, because are they all balanced? And then we could find out that question a little bit more in depth there. So, but don't just take supplements. I gave you those 4 supplements for a reason, because I know it improves your immune function and artery disease. And so if you have artery disease, arterial cell, if you have hypertension, diabetes, all those things, so arterial cell and NEO40 are very important, glutathione and vitamin C. I've got a lot more supplements I can give you. In fact, I'm doing a webinar on the top 10 heart health supplements next week. And anyway, so those are all the top ones, and I'm quite comfortable giving that to anybody. But when you're talking about hormone supplementation, I think it's important to get tested to see if you have that issue that way. So there's problems seeing the slides. Well, I can send the slides off to people there. The slides might be blurry. I apologize for those things there. I can send some of the slides for you guys if you guys want that. So that's something I can do. We'll have a recording of this too. I think that's available. What's the optimum heart rate when exercising? Someone's 50. Get tested. We do a clinical fitness assessment at the HeartFit Clinic to find out what's going on with you, to find out specifically what's happening. Otherwise, I'd want to know a lot more about you. I'm not in the business of giving people target heart rates as to where they should be exercising without knowing anything about them. So I try and refrain from that. I like to do a little bit of a consultation and see what's going on with you specifically. So I'm not going to give specific heart rate advice. Regarding arterial cell, is it a supplement or a medication? Again, it's a supplement. It's something that to supplement what you're already doing. It's not a medication, but it does have benefits that are better than a statin medication based on early literature now. So and the reasons why cardiologists are so happy about statins is because it's not really about lowering cholesterol. We know that. I do a whole talk just on cholesterol and the data behind that. But what happens is we know that if we lower cholesterol, we do see a little bit of a reduction in heart disease, but why cardiologists are excited about it, because it actually changes what we call the lipid-rich necrotic core. And so that's the reason why statins are so popular amongst cardiologists. And so I think this supplement's going to give that run for money there a little bit. So are arterial dosages patient-specific, or is it one standard dose for everyone? Right now, the dosage and the studies are done on two a day, and And that's really the same we give for everyone. If you're taking it just for health reasons, I mean, I've been taking it just to see. I always test things. I took it back in the fall, but I always test things to see if I notice any side effects or what people feel or what, so I always test everything before I give it out to people. But it's right now it's one standard dose for everyone. The best thing for restless leg syndrome. Well, I'd like to find out why. I think there's a lot of reasons as to why that is. And if I were to give you the most important thing is the micronutrient test. I think that would be the most important thing that we can do to find out why. And again, we get more in depth with that part of it. So that's that's one, that one there. So I just want to make sure I got a lot of questions here. Another arterial cell question. I answered that one. Okay, here we go. So does external counterpulsation help heal bundle branch block? The quick answer to that is no. It does heal artery health, artery function, and does grow new arteries. So my big question is, I want to know why you are in bundle branch block. And if it is a reason because you have artery disease, then yes, external counterpulsation would help you. So bundle branch block is an electrical problem. Electrical problems don't get fixed necessarily with just doing one type of treatment. So it's about looking at a few other things there. All right. Can the virus affect someone with atrial fibrillation? Yes, it can. And sorry, I just got another, I think I just lost that question. So let me answer that there again. So can atrial fibrillation, if you have atrial fibrillation, again, it comes into the reason as to, well, why do you have atrial fibrillation? That's what I like to look at the clinic here. What is the culprit? What is the underlying root as the reason what's going on there? And we go through a series of things in our clinic. And so what I welcome all of you is that if you want a consultation, a free consultation with any of our clinics in Calgary and Edmonton, I know there's hundreds of people online here. Just don't call all tomorrow, but we can schedule a consultation. We can have a FaceTime and talk about what we can do specifically for you. And so, we can do that for you guys on the webinar today. So if you're interested in that consultation, understand what we can do for you to get more specific, we can definitely get into that. So atrial fibrillation, the quick answer to that is yes, you might be more susceptible to COVID-19, but I'd like to know why you are, why you have the atrial fibrillation, and that's why you would be more susceptible to the COVID-19, because it can then affect your immune function. Okay, so what else do we got here? What is normal blood pressure? According to doctors, there's a difference between women and men, and best time to check. So to me, normal blood pressure is under 120 systolic and under 80. 80. I like 80. So under. Remember, I said under 120 and under 80 diastolic. And so that's to me what normal is. If you're anything above that, then I'd like to get into the reason as to why you are in that situation. So there are different pockets that we can look at. Is it artery related? And if that's the case, it takes a year or so to change the artery to the good or bad, right? And so is it micronutrient deficient? Is there underlying concerns that's going on as to what's happening with that? Is there hormonal abnormalities? Is there heavy metal toxicity? All those things that we can look at. And so we start to look at these umbrellas with blood pressure, with AFib, and to see what's going on with that part of it. So anyway, that's with normal blood pressure. Statin, is there a camp takes view on statin is bad, weakens muscles, including heart muscles, view on that? I do a whole talk on statins and cholesterol lowering and all that part of it. I think it's important to understand those. It's so important to understand your particle sizes, the atherogenic particles that I'm talking about. If you go on our website and look at lipoprotein particle size testing, that's what I want. Everyone that's taking a statin, I'd want to know that. And therefore, I know what I'm dealing with specifically as to what are the plaque-causing particles. Am I a fan of statins? No, I'm not a fan of statins, and I think there's a place for it in the right population, but it's definitely not the mass population, and it's definitely not the population even with high cholesterol. So to me, it's about finding out what's going on. Again, I can do a whole talk on this, so I'm just gonna say that my view on statins is, yes, there are a lot of there are benefits to it, but there are also some side effects, and that's an individualized question I like to answer with people based on what we get back with us. And so I'll keep that one there. All right, so in what way does COVID-19 affect coronary artery disease? So first degree block, is it further plaque settling of the arteries? So COVID-19, so COVID-19 can affect coronary artery disease. So I hope I'm answering this question properly. I'm going to answer it this way, and hopefully you can ask again. But COVID-19 presents itself with coronary artery disease symptoms. And the reason why it does that is because it undergoes through that. There was that slide I was talking about where it affects the lung function. And so what happens is it affects our respiratory function, and therefore can cause, it basically can also cause heart inflammation. And so when you talk about first degree heart block, that's not always the symptom that comes from that. Usually we see elevated ST changes. We can see some arrhythmia start to occur with that part of it. That happens more with the current treatment options that they're using. And for further plaque settling on the arteries, I think at the end of the day, it affects your immune function. And so COVID-19 attacks you, and so it's a virus. And so we're trying to prevent this from going out of our body. And so the immune function is the most important thing that we can do to fight off the symptoms that can be present from heart disease, or the symptoms, whether it's masking itself as COVID-19. So those are, hopefully I shared that well, because if you have COVID-19, you could present yourself having artery disease, but you do not have artery disease. Those symptoms that happen that from artery disease resolve itself as this COVID-19 does. Now, you can also have heart disease and then be more susceptible to COVID-19, and then we don't know what's what. You could come in, as I showed you, you could come in with flu-like symptoms and that type of thing. So those are the things that happen from that level. And so hopefully that answers that question. Again, I can go super in depth for that part of it, but yeah, COVID-19 can affect artery disease because of the immune function. So I have a question here. Someone's been taking Neo40 for a while. My nitric oxide levels are up to par. Should I be taking Neo40 regularly still, or every other day is okay? I'm sorry, I do not have enough information to share that with you. But if it's just a regular Neo40 and not the Neo40 professional, it's daily. It's something that you want to take daily, because unless you're doing something else to improve your nitric oxide levels, then you could consider taking it every day. So every other day. And so I would suggest taking it daily still, until we start to look at a food log and what you're having and what foods you're having on the days that you're not taking it, all that part of it. Those are all important things. And more importantly, are you just taking it for, is everything optimal? Is your blood pressure okay? Is your artery disease okay? So those are a lot of factors to be going through with that part of it. Excellent. Well, thank you for all the questions there. I think I got to most of them. And I know there's lots of people on here, but thank you for taking the time again out of your busy day to be here. As promised, I wanted to keep on time and be respectful of your time today. And yeah, if there's no other questions, I don't see them. I think I got through most of them. But if there's any other questions, I'll be happy to answer them. You know where we are. Again, welcome. Take advantage of the free book, and also take advantage of the consultations if you want at our clinic at any point. And if you want the supplementations, you can pick them up at either one of our clinics, so that we can help you a little bit further with that part of it too. So thank you very much, and live happier, healthier, and longer, and be safe out there. Thank you.